Confused about home care versus home health? Let's clear it up. We often run into the confusion where clients will call us and say, you know, the social worker or the discharge planner in the hospital has already arranged for home health, so I don't need somebody to come. So I figured I'd touch on the difference between the two because we do work hand in hand with home health, but there is a difference. Hi, my name is Juan Tuason, owner of Paragon Home Care, and today we'll talk about the difference between home care and home health care. First, home health is skilled care services which require some form of licensure or professional degree. So for example, a physical therapist, a nurse, obviously, occupational therapists, speech therapists, and other prescribed services essentially. When it comes to paying for home health, that is covered under Medicare. It's considered short-term disability or short-term care, and typically the coverage lasts for about 2 to 3 weeks. It's generally post-illness or post-event hospitalization or surgery, and most of the visits from a professional last 30 to 45 minutes. Home care, on the other hand, is something that is not covered by Medicare because it's considered long-term care. It is covered under long-term care insurance if you have a long-term insurance policy. The services under home care consist of personal care, which is help with activities of daily living, like toileting, bathing, standby assistance to prevent falls, meal preparations, and medication reminders. The providers of care that we send to the homes for home care are typically CNAs or certified nurses assistants or personal care aides. Some states they call them home health aides, HHAs. They require certifications and training but not nursing licenses. Going back to the pay, long-term care insurance is one way of providing it if you have a policy. But primarily we are a private pay industry with hours that are flexible. It's based on the client's needs, anywhere from 2 hours all the way to 24/7 care, or including live-in. Sometimes we have caregivers that actually live in the home with the client to provide care on a regular basis. Home health and home care often work complementing each other. Our caregivers are there to fill the gaps in between the visits of the home health. Oftentimes the nurses will come or the physical therapist will come to do rehab session. Our caregivers are there to then emphasize and help maintain that on a day-to-day basis. So in short, it's not an either-or situation. To get comprehensive care for your loved one, there's a role that each of those play. Think about it compared to a hospital. When you go to a hospital, you have the caregivers that come in and do the activities. They bring the food, they clean up around your room, and then you have the specialists that come in to give you the medication and change the IV bags or to evaluate your vitals. They're working together as a team to provide the care. In conclusion, we, Paragon Home Care, provides the home care part of it. However, we work daily with home health partners across the Northern Virginia area. So whether you need home care or home health, we can help support to ensure you get the care that you need. To learn more about working with us, go to paragonhomecare.com. Thank you.